I'd like to welcome everyone to today's lived experience webinar. So today's webinar is titled Flipping Stigma in Action, Building Confidence and Competence in Advocacy. So my name is Kim McKercher, and I'm a provincial coordinator for the Alzheimer Society of B.C, and I will be your host for this afternoon. So thank you all for joining us today. I'd like to introduce Dr. Jim Mann. So Jim is the co-lead on the Flipping Stigma research team, who also lives with dementia, and he has long been a valuable leader and partner in much of our work at the Alzheimer Society of B.C. So Jim works both behind the scenes, serving on our board of directors, and contributing his expert knowledge and lived experience to numerous projects, as well as in the public eye, sharing his personal story to break down stigma and inspire others to take action. So the University of British Columbia has recently recognized Jim as the most influential person in Canada in countering stereotypes and building a more inclusive society for people living with dementia, awarding him an honorary Doctor of Laws degree. So thank you so much, Jim, for being here today to talk about the important topic of advocacy, as well as the Flipping Stigma Toolkit. It's lovely to have you. All right, so I'm going to talk a little bit about this webinar series. So this webinar is part 3 of a 4-part Flipping Stigma series. So in webinar 1, we discussed the real-life examples of stigma and discrimination that many people living with dementia face, and we discussed some ways that you can respond if those situations happen. And then in webinar 2, we spoke to 2 action group members, Myrna Norman and Lynn Jackson, who shared their personal stories of living with dementia and discussed how they found the courage to respond to stigma, to educate, and to encourage others on the dementia journey. And then in today's webinar, we're going to focus our discussion around advocacy and ways that everyone can take action against stigma. So we do encourage you to visit the Flipping Stigma page on the Alzheimer Society's website for more information on this webinar series. So you'll find links to the recordings of both part 1 and part 2, as well as information on the final webinar, which is coming up in February. And that webinar will focus on participatory research, and we'll have some more members of the research team, as well as the action group members, talking about the importance of involving people living with dementia in research. So for those of you that might be new to the toolkit, if you had not joined us for part 1 or part 2, I just want to give a very brief reintroduction before we dive into today's topic of advocacy. So the Flipping Stigma Toolkit is an online tool that everyone can use. It was developed by an action group of people living with dementia from across BC in collaboration with UBC researchers and a web designer as part of a CIHR-funded participatory action research project. So the goal of the project was to better understand and address dementia-related stigma and promote social inclusion of people living with dementia. So in the toolkit, action group members identify real-life experiences of stigma and discrimination, different ways that they have chosen to respond to it, as well as share tips on how to develop confidence as an advocate. And that's really where we'll focus today. And the Flipping Stigma on its Ear Toolkit has been peer-reviewed by experts and listed on the World Health Organization's Global Dementia Observatory Knowledge Exchange platform as one of their top 10 resources for dementia support. So I think that really speaks to the importance of this resource and why we've spent so much time on this series, really making sure that people know how to effectively use it and get the most out of this tool. All right, so when it comes to advocacy, which is our topic for today, we really all have a role to play. So we can define advocacy as the actions a person takes to create change. And the Flipping Stigma Toolkit has a section titled Education and Advocacy, where you'll find helpful strategies for building confidence and competence as a dementia advocate. But before we take you to the toolkit to discuss those strategies in a bit more detail, we want to talk about advocacy in general. So we often think about advocacy as being something quite big, like advocating for legislative change, which it definitely can be, that's part of it. But it can also be just talking about your lived experience of dementia with those in your social network, with those in your community, and even healthcare providers, as well as sharing information about how others can best support you. So sharing your experiences And talking about dementia, it may seem like a small action, but it can be a very powerful tool to challenge stigma and break down stereotypes that exist around dementia. And you never know the impact that your story may have on others. It's often much greater than you think. And so, Jim, I'd like to welcome you at this time to talk a little bit more about what advocacy means to you.
Thank you, Kim, and welcome everybody. Advocacy is, I don't know, it's a scary word for a lot of people. And it is, I think, uncomfortable, an uncomfortable thought for others. But advocacy, self-advocacy is really important to each and every one of us. It is, I don't know, it's basically saying I'm still here. It's reminding people that I'm still here. It's quietly or nicely, I hope, correcting some people's thoughts. But part of that issue around being, as I say, scary, I think is because so many people really don't feel they have the confidence or the knowledge or anything about dementia. And that's why I really recommend people who are living with dementia, or even and the care providers, who to get some sense of your own diagnosis, get a bit better understanding about what it means to you, what possibilities still exist. Because a little bit of knowledge will actually build your confidence and make you feel comfortable. If someone were to say you don't look like you have dementia, or someone was to, like, why are you putting all the coins down on the counter? You give me 30 cents on your own, which is why I only use bills. But so it gives you that confidence to be able to say up front, I have dementia, and here's the situation. And it's what I say is I advocate to educate, and that's all what advocacy is. I was a full-time advocate lobbyist for my company, and fine, I was an advocate, but I was talking to individuals, whether they be political or public servants, and educating them on the business that we were in. And so, at the end of the day, everybody can be a self-advocate. It's just getting that little bit of confidence, that reassurance. I hope that is a good start.
Yes, thank you, Jim. And I think when we were planning this, we were talking about how kind of scary and intimidating sometimes just the word advocacy can be for so many of us. And often question, well, I don't know that I can do that, or I don't know that I can promote change. And I love the way that you break it down and just talking about every time that we educate, every time we share something about our story, we are advocating.
Because we probably are going to get to this later, but I'll talk about it now. There is that misunderstanding around dementia within the community at large. There's the stereotypes of dementia. There's that, what I call the unconscious bias, that's firmly in the back of people's minds, that you go immediately from diagnosis to long-term care. And so the self-advocacy is educating people that no, I have a diagnosis. I may have been diagnosed however many years ago, but I am still here. And that is powerful for the individual. It's powerful for the person who's receiving the message, and will change minds, will change attitudes. And uh, as I think we all know, that is a lot of what we really do need to do.
Yeah, I completely agree. So thank you for sharing that. And the Flipping Stigma Toolkit has done such a wonderful job of helping people find that voice, and has shared so many voices of lived experience throughout the resource. And so Jim and I wanted to take you to the toolkit and show you where you can find the education and advocacy section. So I'm going to share my screen again. Bear with me for a moment while I do
And
that.
while
And then,
you're doing that, Kim, just
mhm,
um, the toolkit, I think, is a confidence builder, is that one tool that people can access and be reassured that they are not the only one expected to do self-advocacy, that the action group of people with dementia that develop the material within the toolkit, that's their voice all the way through the toolkit. And it's their voice that is talking about living with dementia, that is talking about the stigma, talking about situations. And so I think this is such a helpful tool for the advocacy that we're talking about today.
yes, absolutely. So when you take yourself to the flippingstigma.com webpage, this is what the homepage will look like for you. And to find the education and advocacy section, you're just going to scroll down, and you'll note that there's three different kind of pathways to navigate the toolkit. So there's a pathway for persons living with dementia, for family, friends, and care providers, and then for researchers. And so for this section, we're actually going to go into the persons living with dementia. And then once we do that, you're going to have a toolbar that will pop up, and you'll see education and advocacy as one of the choices. And then in the drop-down menu, you will find building confidence and competence. And so we're going to go there today and just highlight a few of the strategies that people living with dementia have found useful for them. And so you will see that there are 5 listed in the toolkit. And we're going to start with creating a community of like-minded people. And there's a little voice clip if you click here, which will play and share. And these were all filmed during planning meetings for the research. And it's the voices of people with lived experience talking about the importance of finding others who truly get it along the dementia journey. So I'll play that. Jim, give me a thumbs up if you can hear the sound, if you don't mind. Thank you.
I was down at Christchurch. We sat around a table like this, and I was just invited to go down. And after a while, everyone will talk back and forth, and you end up with maybe the same idea that I got the same thing that you have. What do you do with it? And you pick up a lot of information from the ones that are either going to doctors or psychiatrists, and the ones that aren't. Mm-hmm. Yeah, so it was like a free lesson.
And there's safety in numbers too. Like, you just feel more comfortable because for so long before we do, get our final diagnosis and then get into some sort of group setting where there's people like us, we feel like we're the only ones, right? So it's not only lonely, but it's like you just feel like you're just the odd duck, right? And so here it's like coming home, right? It's like, wow, people I can talk and they understand what I'm talking about, and that's really important.
So Jim, I don't know if you can share a little bit about how empowering it can be to connect with others, and when it comes to advocacy, the importance of not being alone, because it can, I think it says right there, it's so hard to feel strong when one feels alone.
Mhm. you know, it is so easy to feel alone. You're alone or with your spouse or partner in the doctor's office, and you're being told you have dementia or Alzheimer's or another type of dementia, uh, whatever the doctor will say. And then, as the recording said, you go home, and then again, you're, besides saying wow, as I think we all have, you are again alone in the house, and it is very easy to stay there. And it is important to be comfortable with your diagnosis, but also very important to get out into the community like you used to do. And very important to join a support group, or where you are able to meet with others and just have a conversation. I remember the support group I went to. Many times for the hour or hour and a half, the word dementia or the subject wouldn't even be discussed or brought up. We would talk about everything else, about travel or the weather, whatever. But other times, the whole time, it was about dementia, and it is important, as we see on the slide, finding allies and finding that support, because when you do self-advocacy, I think once again you can feel like you're on an island all by yourself, but rest assured you aren't. There are so many of us around, and so many of us, I think, having an impact within our own community and within our own families, because often it's, the education in your own family that is that really is required.
Yeah, and I love the idea of finding allies, in addition to connecting with people who are living with dementia, because there are many groups out there. And just as a bystander looking in at the atmosphere that was created by the Flipping Stigma group and being part of some of your meetings, you truly became like family. And I think there's deep friendships that were formed that will be long lasting after this research project ends, and such a significance to people's quality of life when they can be part of something like that. And so there are allies in our research community at our universities through the Alzheimer Society of B.C. and so many other organizations, and helping people find those, I think, is so important.
That's right. But when you do go to a support group, or even just on your own, meet with a couple of people who have dementia, you can be inspired by them. You can all of a sudden feel, wow, maybe I could do that. Maybe I could do that with you, or maybe I'll just, do it on my own. But I never thought that I could do that. I never thought that I could continue. And I think that is a lot of the messaging that is, I don't know, I was going to say is missing, but really it's you almost have to hear it rather than read it. Because when you read it, you can think, oh yeah, fine, it worked for, for that person. But to actually be a part of a conversation where I did this, and wow, I used to like that. I can do that. Is such a confidence builder. a real booster to your self-confidence.
Yeah. So having a, attending a support group is such an opportunity to hear firsthand other people's experiences in these types of projects and groups, and be inspired
Mhm.
by those that are living it. And I think you're right, that peer-to-peer connection and almost having a mentor to walk you through getting started in something like this can be really important.
Yes, certainly. I know I make a lot of presentations, and I've heard from some that others that they, or not necessarily heard, but I've realized, a few years down the road, that where I was told that, oh, I could never do that, they have watched and learned. They have gone to, some society events or something, and they've realized that, you know what, I can do this, or I can participate here, and even just get out in the community and feel a part of it all of a sudden, is so powerful.
Thank you, Jim. And so, in addition to creating a community of like-minded individuals and finding those allies, knowledge, having the access to knowledge and resources and learning about your diagnosis can be so important. And so if you click on this strategy, there's some information and tips for how you can go about doing that. But Jim, you've really spoken about the importance of kind of even preparing. What are you going to say if somebody might challenge your diagnosis or say you don't look like you have dementia? And just having access to resources and learning a little bit about your diagnosis and what you're
Yes,
experiencing.
yeah, because if you don't, if you go home and shut the door, you won't have that opportunity to learn from others. You won't have that opportunity to hear what others might have said in a similar situation, like at a grocery store, or when somebody says, you don't look like you have dementia. I mean, most of the time you're so caught off guard, you're not prepared, even though you may think you're prepared. It just is, wow, you're making such a silly statement. Fine, I I may look good, but that doesn't mean anything. I remember after a conference presentation, I was on a panel, and there were really by far medical people in the audience. And one member of the audience came up to me at the break, and he looked at me and he says, "You don't have Alzheimer's." And I said, "Why are you saying that? What drove you to think that?" And he said, "Well," he says, "look how well you're dressed." I was not prepared for that. But what I did do is respond and say, "Well, what you don't know is that my wife put this outfit together. I did not." And so it's, in fact, you're not looking for something snappy to be um, critical of the person necessarily. You may think it, but it's more, here's my perspective. Here's what you don't see. And or as I've said, when some people have said, "You don't look like you have dementia," and I've said, "Well, you don't live with me 24/7." And so it's, but did I have the confidence to say that, back months after I had my diagnosis? No. because because my mother had dementia, I had seen the whispers, around her, but I had never seen, I don't want to say confrontation, but sort of confrontation like that. And so I would not have been prepared for responding, but it's what you do. It's like the heading of the section, building confidence and competence, and getting the confidence to respond like that.
And I think that's an important message for people who are newly diagnosed or just starting this journey, that we don't just become strong advocates. Even when we have a background, it takes often time. It takes learning about your diagnosis and feeling comfortable enough to access that information when you do feel challenged. Because if we've ever been in some form of a confrontational um, interaction, we often don't know how to respond. And so I did find it a helpful tip to think about those situations and prepare. What might you say? And not in a defensive way, but just asking, well, what does dementia look like to you then? And just kind of challenging back some of those stereotypes.
Yeah, yeah. Let's talk about it.
Yeah, exactly. And I think the teachable moments that you have mentioned before are so key, because you've highlighted to me that it's not often done with intent. It's just a lack of understanding about dementia that so many of us have. If it's not in our lives, we often aren't as aware of it.
Yes, yeah. And I I was reading something just yesterday, um, and it wasn't to do with dementia, but had to do with something around hospitals and hospital care. And the individual who was writing it, I think it was his father that was in the hospital, but he said, until this occurrence that drove my father to the hospital and so on, I've never given any thought to anything around healthcare, hospitals, navigation, and what you need to have, what you should have, and so on. And so that's the case with so many people. They're not bashing you around the head saying, you're dreamy, you don't have dementia. They're coming from, in a lot of cases, just a point of ignorance because they've never thought about it.
Yeah. And a lot of what we see in the media does showcase people late in later stage. And so often we do find that people are surprised that individuals are living out in the community that are actively working,
Yeah.
volunteering, engaging in research. And that's why it's so important that we have webinars like this and we have the
Yes.
toolkit to hear people's voices.
Yeah. Yeah.
So if you spend some time in this section, you can read about tips for learning confidence for around public speaking and even just talking to groups and in social settings, as well as around if you want to organize like a community gathering or event to advocate in maybe a little bit more of a direct way. And then step 5 just talks about considering some of the advantages of advocacy. And there's another little sound clip that I'd like to share before we move on from this section.
We have disabilities, of course we do, and they're hard to deal with, and there's no way around that. But if we can take the points that we've learned through the action committee, like the first question on a sheet I got was, have we identified the main points needed in order to flip stigma on its ear? And I think we have, because I think education and expressing ourselves and feeling confident about ourselves are the two most important things. And I've certainly learned through art, art as activism, and through this powerful group of you folks, that those things, that we can be happy with our disabilities and with our abilities by accepting, by energizing ourselves, by educating ourselves, and by expressing ourselves.
Yeah, and I think that clip highlights something important, that it doesn't have to be public speaking necessarily, or getting out in front of a group of policymakers and shifting change. It can be through art, through music, through storytelling, through poetry. And we've worked with so many different individuals with lived experience who have found an artistic outlet to share their story.
Yes, it becomes a vehicle to generate thought, to generate conversation, to engage.
Yeah. And so for those of you that are listening, one message we want you to take away is that advocacy doesn't have to be scary. It doesn't have to be this big concept, but it can just be starting to feel confident talking about your diagnosis, sharing what supports you, little tips and strategies that friends can do, little adaptations that people can make so that you're able to fully participate in things. Because people don't know what they don't know. And unless we find those teachable moments, and really, I think education here is the key, isn't it?
And you said about finding the teachable moments, but it's taking advantage of the teachable moments that become so important. Putting people at ease with the idea of dementia, so that they get that preconceived notion of the media portrayal, as you were talking about, the frail elderly person needing a walker and not able to communicate in long-term care. We're not there. There are people there in long-term care, but once you're diagnosed, there is a life to live. And part of that, I think, I think it's taking advantage of what you know to help others learn, because what they learn from you is inevitably going to help them with others, because we know that the numbers of people being diagnosed with dementia are increasing, and having that different outlook, having that little bit of knowledge will help them too. As I've said, Kim, in many presentations, I believe in the 6 degrees of separation. You tell one person and they will tell others. That's always my hope. I don't know that for sure, but that's always my hope. And in part, I think part of that will be because they will be surprised that we're able to walk and talk at the same time, and so that type of good news is what people will benefit from.
Yeah, I definitely agree with the idea that there can be a ripple effect. So you throw one small pebble into the pond, but you in turn could be impacting many others. And we've heard stories before when someone has just stopped and talked to their cashier and explained, I am living with dementia. I need a little bit more time. And that then will shift maybe how they approach the next person that is struggling to count their change, or taking a little bit of time to figure out the debit machine, and just slowing down and providing just that little bit of grace for people,
Yes.
asking if they need any support. It can really have a profound effect, but
Yes.
it can't happen unless we build up that confidence to say something in those moments. So you're
Yes.
right, taking advantage of them.
I remember when I when I was going to meetings in an office at Bentall 5 downtown, that I would arrive early and go and grab a coffee. And I had a few times where I would be standing at the counter and I'd be disoriented and really not really know what I was supposed to do there or why I was there. But I remember the reaction of the clerk, and she never said anything. But her body language suggested that, like, oh, are we just, window watching or, browsing and in some ways, I think I remember it so well because she didn't challenge. If, like your example of the cashier, if you are having troubles with the debit machine or having troubles, paying for it, and you are challenged, I know from other experiences, you'll shut down. Like it'll make sure you're going to have real problems with the debit machine, or you just will not be able to pay for the item. And so just that little bit of education so that they don't directly challenge will just have such a positive impact on the lineup, let alone just, with people's thinking about how wonderful the store is because of the way they were handled in that particular situation.
Yeah, and I think it really, taking those moments to have those human interactions, it benefits us all, right? And the store in itself. So thank you.
Mhm.
All right, we're going to shift gears a little bit and talk about advocating in healthcare settings now. But before we did that, Ashton, I'll just check in with you to see if there's been any questions or comments in the chat that you'd like to share.
Someone had just shared earlier on that their mom, who has dementia, found that many of her friends and even family don't want anything to do anymore because of her dementia. So this is some really valuable information that you're sharing with her. And then someone had also shared that they find the same thing with their husband. So this information is resonating, which is great to hear.
Thank you, Ashton. And we heard in our previous webinars that people are sharing the link to the toolkit with family and friends, and asking them, please take a few moments to go through this, because if you were at our previous webinars, there are a lot of voice clips about just little pieces of stigma, little interactions with friends and family that can really lead to isolation, unfortunately. And it's really disheartening, but we do hear that a lot of people lose relationships after a diagnosis. And it's often, again, out of that lack of understanding. But Jim, did you want to respond?
I think that in situations like that, which are very unfortunate, there's that the opportunity to take advantage of some publications that are on the society's website. Yes, you're right. The toolkit is a great reference for families, but because we have seen it, and I heard about a man who was living with dementia and had told me about sitting in the living room one day with his wife and 3 adult children and their spouses, and how they basically were talking around him and as if he wasn't in the room. And so I think it's through sharing these resources from the society or sharing the toolkit might give family members that little bit of insight and reassurance for one thing, but also just insight on, gee, maybe we haven't done this right. They may think, and hopefully you will see a change in family dynamics.
Yeah. Thank you, Jim. Um, so shifting a little bit, in discussions with the action group members throughout the research project, those that were living with dementia, many people did experience stigma and talk about stigma in healthcare settings.
Yeah,
And so some examples that were shared by some of the action group members were that a healthcare provider maybe spoke to their family member or friend that was accompanying them to appointment, but not directly to them, even when it was about their own healthcare. Also, healthcare provider maybe validating the caregiver's experience and not or dismissing the person living with dementia's experience, as well as healthcare providers again saying you don't look like you have dementia, or that's not dementia, or you're not that bad. Those types of scenarios. And the Flipping Stigma group has looked into the research around stigma in healthcare settings, and about 40% of family physicians do report feeling unprepared to deal with people living with dementia. And that while we do find that stigma exists in the community, it is actually highest amongst healthcare professionals. And I think that there is a lot of reasons why that happens. There's only so much training people can do. There's so many critical demands on their time and such little time to spend with patients. But it is an issue that the group wants to address, as well as advocate for the toolkit to be an accessible resource that can support healthcare providers so that we can start to shift the dynamics and make sure that people have a good, strong relationship that's built in trust and mutual respect with their primary physician. And we're going to show a video. But before we do that, Jim, do you mind sharing an experience that you had where you faced a form of stigma in a hospital setting?
sure. I was in a very busy emergency a number of years ago, and we were down here, and the nurse came from up there to call out people's names, and so she called out my name and said patient only. So I got up and my wife got up, and we were walking down, and halfway there she yelled out again, patient only. So I got up to her and said, I have Alzheimer's and I would like my wife to be with me. And she looked me up and down. She says, well, you look fine. And that took my breath away. But I didn't respond at the time, but I had to spend a little bit of time there, and I was sitting out by the nurse's station, and my wife was explaining that she had to leave for a bit, and she, I think, challenged my wife another time about, why do we have to make sure that he doesn't wander? And so I did have a short conversation with her, and so did make the point. But it is challenging for the healthcare system. I was told by a neurologist once that they get doctors get educated from here down. They really don't get educated on the brain or many aspects about the brain, and so I look at it as it's my responsibility to educate you, um, uh, and show the day-to-day aspects of living with dementia. rather than the medical side, the purely medical side of living with dementia. And that's because, as you point out, we really don't have much time with our doctors. It becomes a challenge, but I do see it as a bit of a responsibility, so that fine, I'm not necessarily walking as much as you would like me to walk, but I just reiterate, I get disoriented when I go for a walk, just without a purpose. And so I don't. And, he has to be reminded periodically that this is what I'm living with. And so it's, again, it's not out of, um, anything but concern for my health, and you should be doing this, you should be doing that. But it's also just out of ignorance of dementia, of living with dementia. And I think that the action group, as a collective, had many experiences, many stories around their interactions with the medical system. And so I think they have done a really good job of highlighting these in short quips, again, like you were showing, that there is that unconscious bias, there is that stigma around dementia. Many doctors don't feel the confidence to give that diagnosis to their patient. And I've read where some doctors have been, or some patients have been dear Lord, some people have been patients of this doctor for like 30 years or whatever, and the doctor just feels so badly having to give that diagnosis that they won't. So I like to think this toolkit is helping people, again, giving them confidence to talk to their doctors and correct their doctors.
Yeah, and I think there's so much more that can be learned than what we can pick up out of a textbook as well,
Yeah.
or a lecture hall. So for healthcare providers who are open to hearing these stories and the messages in the video, it can be such a powerful teaching tool for everyone, and just help create that relationship with your
Yeah.
patient.
And we did have uh, uh, a little project recently where some healthcare providers met with some of the research team and other researchers, to pursue this and see if we can't build on it to help educate.
I think it's a really important topic. So let's take a few minutes and we're going to hear a number of stories, both positive and negative interactions that action group members have experienced in a healthcare setting. So I will return back to the education and advocacy section where you can find more resources that will help you build confidence. So there's a whole suite or library of resources here. One in particular that we like to draw your attention to is the Charter of Rights for people living with dementia. I believe, Jim, you were part of the development of this, weren't you?
I was, yes. Yeah.
Very important document, I think. Do you want to say any words about it?
I'm very proud of that document. It was the Alzheimer Society of Canada had an advisory group of people living with dementia, and we had been meeting, I don't know, a couple of years, few years, something like that. And we had made some, changes and in other smaller ways within the society, in awareness or whatever. But there came this point where, you know what, we do need to, I don't want to make it sound really bad, but like draw the line in the sand. We do have rights. And part of it, of course, is, the United Nations resolution on disability rights. But, we did want to establish really upfront that a person with dementia, as a person with dementia, I have the same human rights as every Canadian. And then we outlined seven rights. The following rights are especially important to me. And I think as much as it is not a legal document per se, I know that copies have been, given to family doctors, and by some people, and just basically saying, here, I'm again, don't discount me. I am still living and breathing, and don't assume I am incapable. And so I am very proud of the document. I think it states 7 points very clearly.
Yeah, we wanted to highlight that because when it comes to building confidence around advocacy, knowing your rights is a key part of that. So
Yes.
please, we invite you to download these resources and to take a deeper look at them following the webinar. And there's one other document we want to draw your attention to. And to find that, we need to go back to the home page. And we're actually going to enter the toolkit for the pathway that says family, friends, and care providers. And if you do that, there's more information. This is a great link to share, again, for family members, because it talks about even some questions that you might want to think about so that you're not inadvertently contributing to stigma. And there's also this wonderful PDF that you can download in print, which provides tips for doctors and other healthcare providers directly from the action group members living with dementia. So this is something that they can, it will print like a poster. They can even put it up in their office or share with their colleagues. But it says, talk to the person, not their caregiver or their spouse. So we acknowledge that it's important to have often a companion with you when you attend a medical appointment, to be an extra set of eyes and ears and to provide their observations, because that can be really key in getting quality care. But whenever possible, the person living with dementia should be acknowledged, particularly when the conversation is about their own health care. And so make sure that they're not being talked over as if they're not in the room, and not to make assumptions.
That's,
So
yeah.
big one, right? Everybody living with dementia is unique in their journey. Listen to your patients, know them, and believe them. So a lot of experiences were shared by the action group members where they felt maybe dismissed or unheard, or that symptoms they were discussing weren't validated because they didn't look like they had a problem.
Yeah, yeah. But I think, Kim, I really want to highlight number 4.
Yes.
And not so much as related to medical as much as what that message is. It's saying to the doctor, encourage people to find purpose in their lives. But I do want to highlight that it is so important for people living with dementia to not, say after their diagnosis, well, like, I guess that's it. I can't do this or I can't do that. For some, that's true. They may not be able to do that, but there are other things that may appeal to them. I remember a fellow in my support group who must have been a fabulous salesperson. He talked to people like a salesman for many years after his diagnosis. It was so funny. And my group met for breakfast. And when you would walk in the door, you'd pass a table of a group of older men that were, I think, there mainly for coffee, but maybe sometimes a muffin or whatever. But they were there, I'm thinking, just every week, just to get together and talk. And so he saw them often enough that he finally stopped and he introduced himself to every one of them. He went around and shook their hands, and they said, their name, and it was amazing. And so after that, he'd often come in and he'd, greet so many of them by their names, and he'd shake their hands and would talk to them. I once had to get up and go over and pull them away and say, come on, like, we're placing our orders. And so he went and volunteered for a food bank, and would stand at the door and welcome people there, and he made the day for so many people, and he loved it. And I think it just is so important. As my doctor used to say, you need a reason to get out of bed in the morning.
Yeah, I think finding a purpose, finding meaningful engagement in life is so key to our overall health and well-being.
Yeah.
Even for us who are not living with dementia, but particularly for those who are, where things are changing, and we know that it can be a journey of losses, but finding those skills that remain, because we all have them, and maximizing those in some way, and having a healthcare provider that encourages you to do that from the beginning. I've heard many stories now where that first interaction after the diagnosis really shaped years of people's lives, whether they got actively involved right away or they went home and they isolated. And so I loved that, what was said in the clip around the doctor telling them to go home and get their affairs in order, but then also go live as well as possible, and encourage them to get involved, make the most of the time that you have, because it really is key for so many people. And I would say I've heard many people share that that has helped them cope in so many ways.
That's why I'm as good as I am right now.
Yeah. So a very important one, because you never know the impact and the way that you'll shape somebody's journey moving forward from that initial appointment. And then another point is just be aware of available community and dementia-specific support. So talk about the Alzheimer Society, talk about other supports available to that individual that are unique to their community, have a resource that they can take home in their hand, because something tangible is often needed, because people can't process everything that's shared in that initial meeting. But knowing that there's resources out there when they're ready, and somewhere to connect with others on that journey. And then I think this one's come up a lot, but knowing that sometimes the person you're working with might not look like a person living with dementia, and to try to really avoid that stereotype,
Yeah.
and not inadvertently promote stigma by making comments like that, because it happens frequently, both in the healthcare sector and outside of it. So this you can actually just click here and download, and we encourage you to share it. That is one way that you can actively start advocating at your healthcare appointments, at long-term care settings, hospital settings, all sorts of places.
Mhm.
So we have one final resource that we wanted to share with you today before we bring our webinar to a close, and that is a new resource that was developed by the Flipping Stigma team, and it is an action groups guide. So in addition to the toolkit, the Flipping Stigma team created the Flipping Dementia Stigma, an action groups guide. And this guide was created by action group members to provide direction for future research projects and collaborations where people with dementia serve as co-researchers and partners in the change-making process. And it just really showcases what the group accomplished together. And so they wanted to really leave kind of a floor plan or a guideline so that the work doesn't stop here, and that there's a template for others to follow. If you're interested in a topic, and it doesn't have to be stigma, it doesn't even have to be dementia related necessarily, but if you have a cause that you really are interested in advocating for, there's some wonderful steps about how you can go about doing that. So I will just share that. It'll be my final screen share, I promise. I know I'm throwing a lot of resources at you today, but this is a web page that will take you to the action groups guide. You can actually order a paper copy as well. They have some beautiful booklets. So if you prefer to have something in your hand, that's available as well. And we'll talk a little bit more about the research side of things in our next webinar, but we just want to highlight this section on how to create an action group. So there's lots of stuff in here that it's going to go by. But what
No.
we want to kind of focus on is this section here.
Yep.
And Jim, is there anything you want to start off with?
Well, I just a little bit of background. The members of the action group realized what they had done, what they had created, the toolkit, and also a T-shirt, and realized the support they had given each other. It wasn't a support group, but just their interactions. I mean, we're now into 81 or 82 meetings. And they said, you know, we have something to share. We need to create this guide to help others so they don't have to recreate the wheel. And so there is the how you can create a group like this. And it's just, you know, four easy points as far as if you see a need in your community, or as it says, become curious. How could that need be best met? So you might sit back and think about it, and then you find a few people to talk about it, and you meet together, and then, as number 4 says, as your group connects and ideas become fleshed out, consider taking them further. And on the next page then is I don't know why I'm showing it. You're doing it.
It's okay.
There is the step to step that the action group is offering people to reflect, and you know, a couple of sentences about that, and then sharing it with a couple of others and establishing connections. and all around the issue that you believe is a gap or an issue that you want to pursue, and you allow that to evolve. You talk it out, and the big one, I think, is practice patience. Nothing like this happens overnight. It's but you know, at the end of the day, I don't mean to talk for the action group members, but I think the action group members would all agree that yes, 80 meetings were a lot of meetings, but they were patient as the toolkit was developed. They were patient as the t-shirt was developed. They were patient about the development of the guide, and it all took time. But taking that time ensures that what you have at the end of the process is valid, is worthwhile, is, you know, making its point or solving a problem or whatever the case may be. But I think it is going to be a big help to others, you know, locally or around the world. And in fact, the middle of last month, we were told that it has been accessed around the world, in Switzerland and Brazil and Australia, Singapore, and throughout Canada. So I think there are good lessons to be learned here. And I know that on the first page of the website, it does talk about shop. You can go to the shopping, or not this website, sorry, the toolkit. But there is the online shop now. And I think the guide is available to be ordered through that, I think.
Yeah, we
Or it
can
will be.
show you the shop. It's on the top of the
Yeah, there.
toolkit. So if you go to the Flipping Stigma toolkit, and I'm not sure the guides are up quite yet,
Oh,
but
okay.
all of the t-shirts, and there's
Yeah.
beautiful Celebrate Life t-shirts and hoodies that have been designed by action group members, which it's a really cool design. We've seen them in person and they are very popular. So the proceeds do go to support research like the Flipping Stigma group, specifically for dementia research. So if that's something that you're interested in, there is a link available, and the guides will be available there as well to purchase their beautiful booklets. And I myself was really excited when I saw that the group created this guide, because I was just blown away by the work that you all did, and it was over 3 years, I believe. So when you say have patience, it really does require patience, but the product is so meaningfully done. It's accessible and utilized all around the world. I know just from these webinars, we've had people in the comments saying that they're going to check it out. They're going to share it with family and friends, share it with their healthcare provider. And so the impact, I think, is huge that the group has had. And it's lovely that there are guidelines now for others to follow suit. And there's even guidelines for discussion and all sorts of goodies in that booklet. So please check it out. We really encourage you to do so.
Actually, it was 4 years.
4 years,
Yeah.
okay. It's a long time, but such meaningful work to come out of that time together. And then we just want to bring attention to a new opportunity that the Alzheimer Society has, that we have the First Link Dementia Helpline, which you may have seen popped into the chat a few times, but it is now available in the Yukon. So you can call the First Link Yukon Dementia Helpline if you are joining us from the Yukon today. And the society staff there will provide confidential care and support to people living with dementia, their family members, and really anybody who has a question about dementia. So it could be a student, the general public, or a healthcare provider. So to support Yukoners on the dementia journey, the Alzheimer Society of BC is collaborating with the Yukon government to launch the new First Link Yukon Dementia Helpline specifically for people living in the Yukon. So the number is there on your screen. And then we also just want to draw your attention for those of you in British Columbia that we have the First Link Dementia helpline available. English services are available Monday to Friday, 9 a.m. to 8 p.m. at 1-800-936-6033. And we also have helplines for the Chinese and South Asian communities available from 9 a.m. to 4 p.m. And that is about it. So thank you so much, Jim. We appreciate it greatly that you're here and able to talk about advocacy, the amazing work that you've been doing with the Flipping Stigma team. And I hope that it resonated with all of you joining in today. So
I hope
thank you
so.
so much.
Yeah. Thank you.